introduce you all to our new assistant director, Dr. Janice Phillips. She's been with the agency a couple months now, and she has really hit the ground running. And I'm so excited to have her here with us today so that she can say hi, introduce herself, and talk to you all for a moment. Dr. Phillips, take it away.
Thank you so much, Lubia, and thank you for inviting me to spend a few moments with your group. Good evening, everybody. I'm delighted to say a few words. First of all, say anything, let me say, thank you for your service as an ambassador. I remember when COVID hit our
please
city.
Go.
When,
I'm clicking 100 times.
Program
It should have opened 100 times by now.
was being launched, and I signed up to be an ambassador, but
You're muted. You can press
do that too long because I got called away to do some more activities at my institution at that time, which was Rush University Medical Center. But anyway, I'm Dr. Janice Phillips. I'm a nurse by training. I've been in this profession for a number of years. I started in 1999, but I have got to tell you, I've had just a wonderful time doing all kinds of things, from being on the front line as a nurse during direct patient care, and then I fell in love with emergency room nursing, where I really got my introduction to public health. I don't know that we always think about an ER as being an opportunity to promote public health, but that's a great place because you see things from premature births to car accidents, you see violence, you name it. I've seen everything. Became just so fascinated with that kind of work. Went back to school, and then I came to the community to coordinate clinical services on the west side of Chicago at Miles Square Health Center. Then I went from there to do breast and cervical cancer screening in the community.
You're unmuted.
With a grant from the Illinois Department of, the Illinois School of Public Health. And that experience of providing clinical care, both in the acute care setting and also in the community setting, is what kind of inspired me to go back to school, even though I kind of swore that I would never go back to school. But I found myself going back. I got a PhD with the emphasis on public health nursing. And I decided to leave my comfort zone and go to the East Coast, where I became a professor at the University of Maryland, teaching community health and oncology nursing. And ironically, on this call tonight is Dr. Fgjtfvngecbyfvbugggfghiik. I don't know if she will remember, but she wrote a wonderful chapter for my very first published book called Women's Health Across the Lifespan. She contributed a wonderful, wonderful chapter on looking at Hispanic women and some of their health issues and priorities for research and policy. So, and ironically, today I have the pleasure of working with her daughter.
Yeah, and how interesting, because I do remember, obviously, that chapter, and I never had a chance to see you or meet you personally, but it's one of the books that I used for referencing, because we had a lot of interesting material on other women of color, and it was just a wonderful piece of work. So thank you.
Well, thank you for your contribution. So, after I taught a little bit, I had the pleasure of working at the National Institutes of Health, working on a number of disparities initiatives, and then I came back home to Chicago, to the University of Chicago, and I helped with nursing research. And that's when I got the policy bug, because my research was focused on breast cancer in African American women. That piece of work literally took me all over the world, presenting, talking about disparities. I spent several months in Brazil trying to replicate a portion of my work. So just a lot of great things, but what was missing, and I didn't realize, was this connection to policy. So on one hand, we talk about getting access to care, making sure people have what they need.
Okay.
We talk about the research, trying to understand their experiences. But when I finally connected the dots, what was missing was that policy piece. So I was blessed to do a health policy fellowship in the U.S. Senate, where I learned a lot about the policy-making process, what works, what doesn't work, why it takes so long. And then from there, I've done a variety of things. I like to write. I love presenting, and this has had just a phenomenal career. And now I have the distinct pleasure of serving as the Assistant Director at the Illinois Department of Public Health. And ironically, some of the previous directors of IDPH I've actually worked with, or I have known, or have collaborated with over the years. So I'm grateful to be there because now, at this stage in my career, I can really pull everything together with my background and with my passion and with my interest in helping to improve the health and well-being of communities. And so that's why I'm excited about the roles that you all play, because you're very important to us. You've got great work. You help us promote public health, serve as spokespersons. You promote our vision and our activities. And I just want to say thank you for that. Ambassadors, as you know, they're champions. They're the ones that go out on the front lines and help us promote our cause. And in our cause at IDPH, of course, is to make sure that Illinoisans enjoy optimal health. You may have heard a lot about health equity, and that is defined as where individuals have all they need, a fair and just opportunity to experience optimal health. But I'm sure that you have known in your travels that everyone is fortunate enough to have everything they need to experience their best health. So we are busy at IDPH trying to integrate that equity lens into our work, into our programs, into our community outreach, and also into our advocacy. And when I work with our elected officials, we are trying to be sure that we maintain a focus or a core element of those activities around achieving health equity. So I know that you all have a busy agenda, but I want to say thank you. I want to encourage you to stay engaged, help recruit other ambassadors, and by all means, please let us know what you might be needing to stay engaged, to stay informed, but also to remain excited about what you bring to the table and what you do on behalf of all of our residents here in the state of Illinois. So with that, I'm going to say thank you again and turn it over to Lubia. And I'm sure I will talk with you again or see some of you again, and I look forward to that time. Thank you so much.
Thank you so much, Dr. Phillips. Really appreciate you stopping by. I wondered if anybody has any questions or comments. I did see somebody in the chat ask if you could say the name or write the name of your book. They wanted to check it out, and I would love to also check it out. So if you get a chance, would you mind putting the name of the book in the chat?
You can also share with me
later, and I can share it out.
Yeah, I'll share with you later. Now, the book is a little old now because we're talking about Dr. Giacello. That was 1994. It was my first published book, Women's Health Across the Lifespan, but it was a great book. And it's in some of the public libraries, and I know that it's in some of the university libraries. So if you want to check it out that way, that's good. But I'll share that with Libya, and then she could share it with you as well.
Perfect. Thank you so much. Truly appreciate it. And I love all the collaboration and, just meeting again in this space and just so many other connections. So thank you so much for joining us.
Thank you.
Share it. Now I'm going to switch it over to our colleague, Sunshine Clemens, from the Center for Minority Health Services, who's going to talk a little bit about this year's Minority Health Conference, as well as a lot of you we got a question about it right off the bat at the beginning of the meeting, but information about how to request COVID test kits for your organization. So I'm going to turn it over to you, Sunshine. Take it away.
Thank you, Lubia, and thank you, Dr. Phillips, for that presentation. That was great information. I unfortunately am not able to turn my camera on, so I apologize to everyone for that. But I do just again want to echo Dr. Phillips' sentiments and thank you all for the work that you're continuing to do throughout our state and helping to increase the impact and awareness of critical information throughout the state of Illinois. So we appreciate you all. As Lubia said, I'm going to briefly talk to you about how to order COVID tests through our division, as well as our upcoming Minority Health Conference. And I'm actually going to start with the COVID test because I do know that we had a question about that right away. And I know I've been here at this meeting before with you all and talked about this previously, but the Center for Minority Health, we have COVID tests that we provide to our grantees, and you can request those. And based on availability, we're able to provide those to people throughout the state to use in their community work, and passing those out. They're over-the-counter at-home tests. We also do have some. I can't think of what they're called, but like the bulk testing, if you're hosting a conference or a seminar or summit and you want to do a large batch of testing on site, we do have some of that available as well. And I'm going to drop in the chat for everyone an email address to the Center for Minority Health Services that you can email your request for the COVID test. And what you'll need to provide is the name of your organization. If there's a particular contact person that these tests would need to be directed to, your address, phone number, and then the quantity of tests that you're looking for. And right now we have a cap of 200 tests to try to make sure that everybody we can provide to all the various grantees that we have throughout the state. Also, there's some issues with some of the packaging. So at this point, the cap is 200 tests. The name of the program, and I will put these as bullet points in the chat as well. And just a brief sentence or two on how the tests are being used in the community, what you're using them for, what type of program it is, et cetera, so that we can kind of track that information and see the impact that it is having. So again, it's the name of the organization, a contact person in that organization, address, phone number, how many tests, up to 200, the name of the program or grant that it's being funded under, and where the tests or how the tests are being used. So I will actually, Luby, would it be better if I just sent you that information to put into an email to them versus putting it in the chat?
We can do both. I know there's some folks that want to immediately send requests as we're having our meeting. So if you wouldn't mind doing it there, but I'll also send it via email.
Okay, I will put it in the chat, and then I will also get that to you.
Wonderful.
Later, and give me just a moment. I'm trying to.
Sure. As you're doing that, Tamika, just wanted to go back. Does that answer your question?
Yes, thank you so much. I appreciate that.
Wonderful.
So I'm copy pasting this into the chat. So bear with me because some of the information, it is copied additional information. So I'm trying to remove some of this. So my apologies, everyone.
No worries. Take your time, Sunshine. I do also want to mention that Dr. Phillips put the name of her book in the chat as well. So take a look there. It's called Women's Health Across the Lifespan, a Comprehensive Perspective. I guess the authors are Karen and Alan and Janice Phillips, 1994, Lippincott Publishers. And she says, thanks everyone for your service. So thank you so much for sharing that as well.
But if the group would like more recent, relevant, published works, I can supply that.
Yeah.
Around like the determinants of health, health equity, those types of things that that I've been not only just engaged with addressing, but also have written about. I'll give you this a little bit more current.
Yeah, that'd be wonderful. I already see folks saying yes in the chat, so let's do it.
Okay.
Great. I have put the information in the chat for the COVID test orders. I will also send that to Luby so that you can distribute it by email. And moving on, well, before I move on to the next thing, are there any questions on that? Great. Hearing none, I want to move into talking a little bit about our upcoming Minority Health Conference, and I am dropping the link for registration in the chat now. This conference will be held December 4th and 5th. The conference is titled Achieving a Healthy Illinois by Eliminating Health Disparities. And this is our 2023 Minority Health Conference that will be held at Illinois State University in Bloomington-Normal. And a few of our conference tracks that we're going to be covering are we have evaluation, research, and reporting, innovative and evidence-based approaches to addressing health equity, building unprecedented partnerships and collaboration, and understanding disparities in healthcare accessibility. There'll be several sessions. There's sessions on social justice issues. We've got some healing circle activity that will be happening. There's just a lot of good information and a lot of good opportunity to learn and collaborate and connect there. And I've worked with the Center for Minority Health to be able to offer 3 free registration opportunities to our COVID ambassadors. At this moment, I don't have the code to waive that fee yet, but I did want to at least announce it to you all. And once that is ready, I'll provide it to Lubia and she can send that information out. But we would like to offer a spot for 3 of our COVID ambassadors to be able to participate in this activity for free. We also do have a virtual option if you would like to participate and are not able to be physically present. But I do want to point out that only the main, I can't think of the word I'm trying to say right now, but the main, like some of the sessions are not virtual, only the, I'm drawing a blank. The main session, the main presentations are going to be able to be accessed that way. So just be aware that if you are participating virtually, you won't have access to all of the information, but you will still have a good chunk of it. And again, that's in Bloomington-Normal at Illinois State University on December 4th and 5th. I've put the link to registration in there, and there will be more information coming to offer those a couple of seats up, to our lovely ambassadors who have, been partnering with us throughout the pandemic and beyond to try to support the work. So we would like to make that offer. And if your office or company is able to pay for that for you, it would be great if those could go to someone who may not have that opportunity. But we will provide that information to you as soon as it is available. It's in the process now, but since this meeting was happening, I did want to get on here and let you all know that would be forthcoming. And I will turn it back over to you, Lubia, unless there are questions.
Yeah, does anybody have any questions? Right off the bat, I know that some folks might be thinking like how much it costs, if we have that information.
We do. It is, just so everyone knows, when you, on the link that I put in, when you go to the registration, it pulls all of that information up for you. If you register before October 23rd, the early bird fee is $100. If you register before November 20th, it's $125. And then after November 26th, it becomes $150. If you're doing online only, plenary, that is the word I was looking for. I'm looking at it now. The plenary sessions that will be available virtually are $50. If you are a full-time student, it is $25. The pre-conference is $75 or $25 for a full-time student. And I will copy this and put it in the chat as well.
Awesome, thank you. Yeah, I'm looking at the page, on the registration page, and you're right, it has all of that information. Does anybody have any questions for Sunshine, either about the Minority Health Conference or about ordering or requesting COVID kits for your organization? And again, you can put your question in the chat. I'm happy to read it out loud. You're welcome to come off mute as well. Go ahead, Tamika. I see your hand up.
Thank you, Lubia. And Sunshine, can you tell me what the turnaround time is when you guys would normally ship those out, what that's looking like right now? Because we're really needing them for sure for a large conference that we have coming up for our youth council for NAACP, and those would be very helpful for us to have.
We try to ship them out within a week of receiving the request.
Perfect. Thank you so much for that information.
Of course.
Great. Anybody else? Any other questions? And if you think of any questions later on, or if you're still confused about the process, please feel free to reach out to me, and I'm happy to connect you with Sunshine and share the process with folks. So thank you so much. Thanks so much, Sunshine, for sharing that information with us. I'll share out this information that you put in the chat, as well as the link to the conference in our post-meeting email.
Wonderful. When do you normally send that out? I'm wondering if I can possibly get the registration code prior to that.
It should be probably tomorrow afternoon.
Okay. Fingers crossed. I will work on that. Thank you,
Wonderful.
everyone. Appreciate your time this evening.
Thanks so much, Sunshine. All right, moving right along with our agenda, I'm going to turn it over to my colleague, Karen Lyons, who's going to give us a presentation on the latest COVID updates. And this information is for you all to share with your networks, with your community, with your organizations. But we're here, we're lucky to have Karen here, and so grateful for you to have made time for our meeting today. Karen, I have your slides pulled up, but if you wanted to share the slides on your end, you're welcome to do that as well.
Hi, good evening. Go ahead. Look, why don't you go ahead and share them? I'll just let you know when to flip to the next slide.
Sure. Give me 1 sec. I'm just going to set them up real quick.
Sure, no problem. Thanks. All right. Let me know when you're ready for me to start.
Oh, sorry. I had a little bit of technical difficulties, but I'm good now. Go ahead, Karen.
No problem. Okay, hi, I'm Karen Lyons. For anyone who doesn't know me, I am the immunization section chief at IDPH, and I've been here a couple of years, and prior to that at local health department level. So glad to be here with you all. You can go ahead and go to the next slide. And the next one. Okay, so first thing, I have a few slides just to talk a little bit about some really basic clinical stuff. I know we have limited time, so I'm not going to dive too deep into anything, but I kind of have a few sections here I want to talk about. First one being some clinical information, which is, so the updated 2023-2024 COVID-19 vaccines are on the market now for all age groups. The mRNA vaccines, so Moderna and Pfizer's vaccines, are available for as a single dose for any person 5 years of age or older. So whether they've been vaccinated before or they're being newly vaccinated, they would just need one dose according to the current schedule. If they receive Novavax, which was newly authorized just a couple weeks ago, they would need 2 shots if they are unvaccinated previously, so newly vaccinated individuals will need 2 doses, or a single dose if they have previous doses of vaccination. And then for the younger children, ages 6 months through 4 years of age, it's a little bit more complicated. The number of doses they need will depend on how many doses they've had in the past, what brands they've had in the past, what brand you're giving to them now, et cetera. So it just depends on their prior vaccination status. So they may need either 1, 2, or 3 doses, depending on that vaccination status. And then for all ages, the moderate to severely immunocompromised individuals may need more doses depending on their prior vaccination status as well. You can flip to the next slide. Okay, so I took the next few slides from, with their permission, from our one of our grantees, so Illinois Chapter American Academy of Pediatrics, put these out. I'm only sharing the non-immunocompromised slides or information because it gets a little bit more complicated with immunocompromised people, but just know that that information is on their website. And I'm happy to share that if people have interest in that. But this is just a, I guess, pictorial, an image of what that vaccine dose would look like. So in the top section, this is for children 6 months through 4 years of age, not immunocompromised. If they are previously unvaccinated, they're going to get 2 doses of Moderna or 3 doses of Pfizer vaccine. And if they're previously vaccinated, it depends on what their previous doses were. So if they've received 1 dose of Moderna, you just give them 1 more. If they've received 2 or more doses of Moderna, you give them 1 more. And if Pfizer is a little bit different because it was originally a 3-dose series for this age group. So if they've received 1 dose previously, you're going to give them 2 more of the new updated Pfizer. And if they've received 2 or more doses in the past, you just give them 1 more of the new updated booster. So you can go ahead and move over to the next slide. All right. 5 to 11 years, not immunocompromised. This one's pretty easy. Whatever if they're unvaccinated previously, just give them 1 dose of either Moderna or Pfizer. And if they previously had a dose of the, something prior to the 2023-2024 updated vaccine, you give them 1 dose of the updated vaccine. So that's easy. And you can go to the next slide. All right, same thing with 12-year-olds and older. So this is for anybody 12 years and up, so children and adults. Children 12 years and older all the way up to adults. Again, if they have never been vaccinated, they're just going to get 1 dose of the new updated vaccine. And if they previously had a dose of something, other than that, other than the updated vaccine, you're going to give them 1 dose of the updated one. And I think I have 1 more slide there. Okay, yeah, so this represents the updated Novavax vaccine. This one is slightly different than the mRNA because if they're unvaccinated, they need 2 doses. But if they were previously vaccinated with another COVID-19 vaccine, they need, you can give them 1 dose of Novavax. And you can go ahead and switch to the next slide. And then so here's the website where those dosage slides were found. This is the Illinois Vaccinates Against COVID-19 project that Illinois Chapter American Academy of Pediatrics has available. So the information on the website requires a login and as a member of one of their groups, but there's a lot of information that is available to the anybody who navigates their website. So they have a podcast. They have all sorts of dosing slides, so including those immunocompromised slides about immunocompromised dosing. They have some social media graphics. They have posters and infographics. There's a lot of great things to look for there, and a lot of them I think will resonate with both medical and non-medical audiences. So go ahead and take a look there if interested, and I'll ask you to please go to the next slide. Okay, so now we'll switch to commercialization. So what does commercialization mean? So basically what this means is that vaccines are now available. The COVID-19 vaccines are available on the private market. Providers and pharmacists will purchase COVID-19 vaccines in the same way that they purchase all other types of vaccines, and they would submit claims for reimbursement for those vaccines the same way as they do for other vaccines. So for instance, they may submit claims to Medicaid, Medicare. In the case of COVID-19 vaccine, it would be Medicare Part B, or private insurances. So, but then we have a couple of publicly funded vaccine programs available as well. So I'll get to those couple slides from now. You can go ahead and go to the next slide. Okay, so this I thought was a really nice cheat sheet from Kaiser Family Foundation. So I have the link at the bottom of the slide. It kind of goes through the insurance coverage of the updated COVID-19 vaccine. So if you're wondering whether somebody with the a certain insurance type or non-insurance is how they'll be able to get their COVID-19 vaccine covered for them. This is a handy chart. So it goes through the private vaccine and grandfathered plans covering grandfathered plans may not fully cover COVID-19 vaccines, but most private insurance plans are going to cover COVID-19 vaccine without cost sharing, meaning no deductibles, no copays, etc. Medicaid covers the COVID-19 vaccine, Medicare Part B, and then underinsured and uninsured, this talks about uninsured adults and children. There are a couple other programs that are available to them, so that we'll get to on the next slide, particularly the Vaccines for Children program and the Bridge Access program. So I'll go over those. You can switch to the next slide. Okay. So just to point out that as part of commercialization, the previous COVID-19 program through CDC has now ended. So anybody who was giving vaccine under that program, that is now expired or terminated, and they would have to join another publicly funded program if they have eligible patients for those programs. So first one is the Vaccines for Children program. We'll talk a little bit more about that, and then we'll talk a little bit more about the Bridge Access program. And in Illinois, we are recruiting local health departments, FQHCs, and rural health clinics to join our program. It is a limited access program, so we're not able to allow anybody, just everybody who previously offered COVID-19 vaccines to be able to join the program. But then there's another half, I guess, to the Bridge Access program through the federal government. So pharmacies may also participate, and they have a separate program than the one that jurisdictions like IDPH have available. So I'll switch. Can you switch to the next slide? There's a little bit more information. So vaccines for children, counting Chicago and Illinois jurisdictions, which are two different jurisdictions as far as publicly funded vaccines are concerned. We have about 1,200 VFC provider sites throughout the state. That includes private providers, FQHCs, rural health clinics, local health departments, some hospitals, urgent care centers, et cetera. The children who are eligible for the Vaccine for Children program are those that are enrolled in Medicaid, American Indian or Alaskan Native, uninsured, and underinsured children. So that would mean like they have insurance, but it doesn't cover their vaccines. So they would be able to get vaccines at certain providers. Not all VFC eligible providers are allowed to offer vaccines to underinsured children per federal law and agreements, but FQHCs, rural health clinics, and some deputized providers are able to offer vaccines to underinsured children. And they, just because I know administration fees come up as a frequently asked question, VFC providers are allowed to charge administration fee. And I should have put this in the slide. I can correct this before it goes out. This is for non-Medicaid VFC eligible patients. They can charge a administration fee of up to $23.87 per dose, but they cannot charge for the vaccine because they're getting it for free from the government. And many providers don't charge that exact amount, but it can be up to that amount. Okay, you can go ahead to the next slide. Then there's the Bridge Access Program. Now, this is for uninsured and underinsured adults, and underinsured is defined a little bit differently for the Bridge program. If their COVID-19 vaccines are not covered by their insurance with first dollar coverage, meaning if they have any kind of copay or coinsurance or anything that they're going to have to pay out of pocket, they would be eligible for the Bridge Access Program. It's a limited time program, is through December 2024. And it is for adults 18 years of age or older. And I mentioned underinsured or uninsured. There are two different programs. So the pharmacies can carry vaccine offered by a different program. And then the public health infrastructure, which is what IDPH and Chicago Department of Public Health and other jurisdictions like us are able to provide vaccines to our providers through. And because the CDC, the old CDC, COVID-19 program has ended, those providers interested in joining the Bridge Access Program do need to enroll with this new program. And they may not bill the patient for an administration fee for that vaccine. All right, you can go to the next slide. And so just here's a little bit of a same thing in more of an image. So Medicaid and Medicare Part B and private insurance with first dollar coverage, they're not eligible for the Bridge Access Program because they have insurance that covers their vaccine already. So they can go to their own provider or a pharmacist if they're in an age group that a pharmacist can vaccinate, and not have to worry about paying any fee. And then the uninsured or underinsured people are eligible to get a Bridge Access Program vaccine through one of the enrolled providers or pharmacies. All right, you can go to the next slide. All right, and then I just wanted to just talk a little bit about communication. Of course, I'm sure you've noticed that there's um, a lot of questions that um, your clients will have for you. So, why is it needed? Is my first slide. Number one, we still have new variants that are continuing to occur, and we need this vaccine updates the circulating. It's updated to include more of the currently circulating strains of COVID-19 in the vaccine. There's also waning immunity. So immunity does decline over time, and it declines over time whether you have the vaccine or infection. And immunity from infection also can be less, could be a little bit variable depending on the person's age and their severity of their illness. So it's hard to tell with infection how long that immunity is going to last anyway. So the vaccine is the best way to kind of get the most stable immunity. Vaccination is also a safer way to build immunity because there is not a risk of severe illness that so you wouldn't hopefully not if you got the vaccine you're much less likely to be hospitalized or have long COVID symptoms than you would be if you did not get vaccinated and got ill. All right, you can go to the next slide. All right, so we're going to talk about a little bit. I'm not going to go into tons of detail here because I'm going to provide some references for you in the slides. You can see that there's a link right there at the top that's a CDC website that addresses misinformation and disinformation. Misinformation is obviously incorrect data that's being passed along from person to person but without any kind of ill intent of spreading that misinformation. So they mean well, they just they're saying something that's incorrect. And disinformation is the difference between misinformation and disinformation is like the intent of what the person who's kind of spreading that information is, whether they have an intent to spread information that they know is incorrect. So just a little bit of definition there. So the site that I have a link to talks about addressing misinformation and some of the recommendations, just very, very briefly. There's much more detail on the website, but listening to and analyzing misinformation that you're hearing on social and traditional media that will kind of clue you into what sorts of things you might need to address when people ask you questions. Engaging and listening with your community is important, of course. Understanding the gaps and what kind of information they need to be able to make decisions, good decisions. Sharing clear and accurate information and using trusted messengers, which are you, to boost the credibility and likelihood of being seen and believed. Sometimes people tend not to maybe trust the government or not trust the pharmaceutical companies. And so it's important to have people that are able to spread correct information that those people can trust. Next slide. All right, and this is just sort of a pictorial. Much more information on the website again, and I know we have limited time, so I won't go into too much, but the main idea is you want to give them the fact first. then kind of understand, you know, what kind of information that they're receiving, explain what the fallacy is. So, you know, you can just explain to them why, um, you know, why something is misinformation, what the actual misinformation is, and then give them the actual fact. And you want the fact to be more memorable, obviously, than the fallacy, so that they'll start to have more confidence in the vaccine. Next slide, please. And I think this is one of the last slides, but tailoring your vaccine message is something important because you may be talking to very different groups with very different concerns when you're out in the community, so or with patients in a clinic or wherever you are spreading your message. So the one important thing, and these are not all the suggestions on the website, this is just a few that I thought were you know, probably interesting to share for today, but understanding your audience. So how do they feel? You know, what does this group feel about vaccines? Where are they getting their information from? Where do they live? Because that where they live does tend to impact the types of possibly impacts their beliefs, and what kind of healthcare do they have access to already? And then create tailored messages for any materials you might be creating. So focus on their why. Why, what would motivate them to become vaccinated? And incorporate any values that resonate with your audience. They may be interested in talking to their healthcare professionals. So that's a great thing to encourage them to do. And then provide details where they might, you know, how they might get vaccinated. So you might want to tell them, you know, go to vaccines.gov or talk to your health department, or, you know, things of that nature, or your own private provider, and you know, or pharmacy, and let them know how they might get vaccinated. And then get their input. If you're creating materials, and I don't know that that's necessarily something you're out doing, but if you are creating materials, get input from those people in the audiences that you're addressing. They can be a real help to ensuring that you're getting the message out the way you intended to. And next slide, please. And then one more website that I thought was really excellent that I wanted to refer you to. I just listed some of the questions that are addressed on this page. So, and this might help you when you're hearing myths or misinformation. It gives you the actual facts and how, you know, I think it might help you to be able to kind of formulate how you're going to answer questions for people, such as, you know, vaccines don't contain microchips and they don't impact your fertility, they don't alter your DNA, etc. So please go ahead and take a look at that when time permits. I think you'll find a lot of that information very interesting. And you can go ahead and jump to the next slide. Okay. Yep. And thank you. I'm happy to answer questions if time permits. Thanks.
Awesome. Thank you so much, Karen. Does anybody have any questions, comments? I know it was a lot of information, but you're welcome to put your question in the chat, comments in the chat. You can come off mute as well. This is your time, folks. This is like, these are the specialists, the knowledge people. This is a good chance to ask the questions that you've been either hearing or that you've had on your mind about these new updates around COVID. Tamika, I think I see your hand up, like re-up. Is that okay? Is that correct?
Yes, I'm sorry. I guess I've had it up all this time.
That's okay.
I did have a question in regards to some of the beginning of your presentation where you were talking about the vaccination. I wanted to find out in regards to, I guess, the standard amount of vaccinations that most people should have had at this point, healthy people, within, I guess, the age groups. How many vaccinations should we have had at this point? And does that matter in regards to the new vaccination that you just mentioned?
Yeah, that's a great question. So, as you kind of indicated, it does depend on how old you were when you received your vaccines. In some cases, so for younger children, it depends on the brand you received. It also depends on whether you were immunocompromised. So just taking a non-immune compromised adult, and also I'll preface that by saying, under 65, because people over 65 were permitted to get additional doses with the last set of bivalent vaccines. They were able to get not just one, but multiple additional doses. So just taking a typical under 65-year-old non-immune compromised adult. Let's see, I have to think about this, but yeah, the primary series was 2 doses, and then we've had a couple of different boosters. So there was a bivalent booster. Let's see, I think I've had 4 doses plus my 2023-24. So I think that would be a typical adult would have 5 doses by now, including the 2023-24. But there's any variety mixed in there, depending on all of those other factors. And then if they had the Johnson & Johnson vaccine, they might have fewer doses because that was a single dose series, but then followed by some additional, boosters. Yeah.
Thank you for doing that math. That's kind of what I was trying to figure out, like what, where are we with that? And does it really affect your getting the new dose right now? So like, is it like the flu where I maybe got vaccinated a year ago? That doesn't matter because there's a new variant, and so that has no bearing on the health outcomes or how the vaccine is going to affect you, or how it's going to optimize in your body based on what you, the last vaccination that you got. It's not going to matter if you had the vaccination last year, your last dose.
Right.
If we're working with a new variant, is that true also?
Right. So there is one stipulation that the 2023-2024 updated vaccine should be given at least 2 months after your most recent vaccination. But you are correct. It doesn't matter if you've had 1 dose previously or 4 doses previously. You can get this new this new vaccine is recommended. And it is, except for the Novavax brand, it is just 1 single dose for anybody 5 or older, unless they have, immune compromise or, conditions that would require them to have multiple doses. But in general, it's 1 dose, except for unvaccinated people who want Novavax.
Thank you so much.
Awesome. I see Ricardo's hand up. Go ahead.
Yeah, I just want to reiterate what she said today. After, it doesn't matter what vaccines you took before anything. The COVID-19 vaccine will be like the flu vaccine. You will get a variant each year. You're going to get a shot every year. What they've done this year is that they know the variant that's coming out of South America, except also from the code, and that variant was put in this vaccine. This is not a booster, this is a vaccine. And this vaccine will now, from now on, starting this year, will be provided next year, one vaccine for the flu and 1 vaccine for COVID-19. There will be no other boosters or anything like that. It'll just be a regular vaccine yearly by identifying the strain that's most alive at that particular moment of time.
Yeah, so I think that's the expectation, is it will change every year like the flu, but if it's the same strain circulating next year, there may not be a change. And if we start to have some very serious different strains before next year, it could change sooner. So, but at this point, the expectation is that it would be, a change, an annual sort of change. But I think time will tell with that one.
For sure. Thank you. Thanks, Ricardo, for that comment. I also see in the chat, Susie, a awesome, amazing nurse, also said that she said actually 5 with this new one, and then she said monovalent new vaccine.
Yeah, so that's actually, just to kind of address that, because it does a lot of questions came up because, the original vaccine was a monovalent strain. I mean, there was one strain in it. It was the ancestral strain. And then we got the new bivalent vaccines about a year ago, where, it included kind of that old strain plus what was circulating at the time. And so we were kind of calling it the bivalent vaccine. And now we're going back to a monovalent, which is, it's still the updated vaccine. It's still the correct one for the strain that's circulating right now. But it is something that's kind of raised some questions and raised eyebrows. So, but yeah, it is a great point that it is a monovalent vaccine again. So, so I think the better word to use is updated, because we were calling it bivalent for so long, and we're like, oh, well, now it's monovalent again. So, yeah, thanks for that comment, Susie.
Yeah, for sure. Anybody else have any questions, comments for Karen? I know you're wrapping up your time, and just want to make sure that we got folks if they have questions. I think we might be good.
All right. Thanks, everybody.
Thanks so much for coming by. Thanks for making time to speak with us, and we look forward to engaging with you again.
No problem. Thanks so much.
Thanks. Take care. All right, moving on to our next agenda item. I wonder if our friends from Roseland Hospital are on the call. Anybody from Roseland? Oh, Myra, do you know if they were able to connect with us?
I'm not sure, but I have Brandon's number. Let me reach out to him and I'll get back to you. Thank you.
Wonderful. Thank you so much. In the meantime, I wanted to talk a little bit about some of the things that I have in store for our for our ambassadors program. So the first thing I do want to address is that I know that there was a lot of technical issues. A number of you have emailed me like, where is the link? Where is the link to the meeting? I don't know what's going on with my outbox, with my Outlook. It's acting funky on me. Let me tell you all, it's acting funky. So I've tried a number of different tactics to make sure that everybody gets my emails, because there was an issue where it was like, I can't send more than 500 emails at a time, and we have so many ambassadors. So then I was like, all right, I'm going to split them up into different parts, right? Into numbers, a number of emails. And then I think the invite didn't go out well. Anyway, let me not divulge. But I do want to thank everybody who was able to connect today. Thank you so much for still trying to get on our meeting, despite all of these little technical challenges. I'm going to engage some of my colleagues here at IDPH to see what I can do to improve communications, to make sure that everybody gets the link in a timely manner, that they can engage with us at the time that we're having the meeting. But then also, a lot of you have also told me that
report today?
That it's challenging, or that after the meeting. Oh, 1 second. Let me just mute folks. that it's challenging to access the post meeting email or like the links and things like that. So trust me, I hear you. I understand that there's a lot of different issues. What I can say is that it's really challenging because because we're a state agency. There's so many firewalls. There's so many protections. So it's been a little challenging in that end. But just know that I'm working on it, and hopefully I'll have solutions and more ways for us to engage in the future. The other thing that I wanted to mention was that you all heard from Dr. Phillips. She's really enthusiastic about the program. She was an ambassador herself, and now, being in the role of assistant director here at IDPH, she's really come up with some ideas, and we have an opportunity to brainstorm around what we want to see or what we want for the program. But at the same time, recognizing that what we want or we might be thinking for the program, it might not really align with what community is asking from us as an agency and from the program. So I wanted to take some time in this meeting to have a discussion around, what you all have in, or, some ideas around what you want from the program, what you think it's lacking, what you think it's, what do you think it needs? Any ideas that you might have, I'm open to them. I know that also in our last meeting, I shared that there was an opportunity to re-engage or recommit, or an opportunity to say thanks. I've had a good time with the program, but it doesn't fit with my schedule, or whatever the case may be. I'm really happy to say that so many of you reached out and said, no, we need the program. We really, we want to keep the program. So it was really exciting to see that. And because of that, I've been able to have really great conversations, not only with Dr. Phillips, but with some of my other colleagues at IDPH. So anyway, back to what I was saying is that this is an opportunity to let me know what you all want from the program. I know also that some of you have been vocal. Some folks, some of our ambassadors at Northeastern Illinois University wanted to start up a health ambassadors program where they engage with us as ambassadors, but then also participate and do activities in their school. I wonder if I know I have some students from that school here. Does anybody want to come off mute and talk about your experience or what you've done so far with your health ambassador program? I know I see Aiden, and I apologize. I don't mean to put you all on the spot, but I just want to highlight, there's so many possibilities for our ambassadors program. We really could do what we want in terms of, responding to community in a public health way and using the resources of the agency. So with that, again, I kind of encourage anybody from NEIU, if you're on the line or if you're on the call, tell us, what you have in mind. If you're just an ambassador who's been around for a long time, what do you think we should be doing with the program?
Let me chime in here.
Yeah. Hey, Aiden.
Hello. Forgive my messy bedroom. So we have a pretty solid thing going on where students can we can kind of engage our interest in public health because it's so broad. And, we appreciate the support of IDPH in giving us resources and information to make it all happen. As you all probably know, state universities are not loaded with money. So any support that we can get is awesome. And I think it gives our students a good opportunity to network and gain some professional development, but also they are aspiring public health professionals, and they're in health majors and biology majors and graduate programs. So this really gives us a chance to engage and do the work and connect with people who are in the field doing the work and learn from that, but also serve our community, which has its own unique set of issues, but it also shares a lot of issues. We're located in Chicago, so we work a lot with the nonprofits that are around us and with the university to make things happen. But overall, it's just a really good partnership to have and a really good support. And yeah, we hope to make the most out of it.
Thank you so much, Aiden. Really appreciate it. Do you want to share a little bit about your upcoming health fair? I know that it's on campus, but maybe if somebody's in the area or if somebody here is from an organization that might be able to support by tabling, that might be a good segue.
Yeah, for sure. We're located in North Park, but our students come from all over Chicago. So we're organizing a health fair on November 14th, and we're inviting organizations from all over Cook County and Lake County and other neighboring counties to come and table at our school and interact with students and families and community members. This event is open to the public, so anybody can come in. You can share the flyers. I can send the flyers to you so you can follow up with everybody else with it. And then you can, if you're interested in coming to table, you can also share my email with them, and we can take care of the logistics to make that happen.
Yeah, for sure. I think I believe you sent me the event flyer, but if you can send it to me one more time so that I can include it in the post-meeting email, and then that way everybody will have the information. If you want to get in contact with Aiden, if you want to participate, that's one way that your organization can do so.
Yeah, thanks, Libby.
Thank you so much. I just also see a comment from Jerry. She says, I would like IDPH to share the initiatives that are priority for awareness. I would like to be a part of providing education and awareness around what's going on in Illinois at my community level. How can ambassadors contribute to the initiatives that are taking place in Illinois? We would essentially support these initiatives at our community events. I think that's wonderful. I'm actually copy pasting your comment, Jerry, because my role here at IDPH is certainly community engagement, but it's good to hear from you all like this. We want to be a part of it too, right? Like if we're at a community event, we have folks, we ask staff like, oh, can you help us with this event? Or can you, volunteer for this? It would be great that maybe we can tap into to our ambassadors and say, hey, do you want to volunteer? And I think I put this out there before around the state fair, and that turned out to be a whole different thing. But as we get ready for the new year and still thinking about what's going on in this year and different events, making sure that ambassadors are in the loop, and maybe you can volunteer with us, or as we do these tabling events, we can engage all of you in that way. Aiden, I have a question from Omira. Are you seeking any other services for 11/14? So for your event, that's November 14th is the NEIU Health Fair.
Maybe we're open to suggestions. We currently are scheduled to do. We're going to be offering vaccines for the flu and for COVID. We're also bringing people in to help with enrolling for Medicaid and Marketplace, and there's another thing, but anything that can help our students primarily. That's most of the funding for our office is to help our students, but we're also opening up to everybody. The issues that we mostly face, there's a lot of substance use, so alcohol, drug, sexual health stuff, so condoms, safe sex, testing, a lot of STI testing we do all year round. And then a lot of mental health. So if any of you are from a mental health org, maybe come and do a workshop or an activity, anything along those lines. And just think something that a college student might struggle with. That's what we're looking for.
Wonderful. And she's asking, do you want Narcan? And Narcan, folks, is oh my goodness, what is the other name for it? It slips my mind, but
it's
Narcan
receptor, I think.
Yes, but there's another name for it, but naloxone. Thank you so much.
Yeah, can I comment on that too? So we actually became a distributor through our police department. So our campus has a supply that's free to everybody. Really, it was intended for our students. But one thing that we started this semester is we have what we call wellness kiosks that are secondhand vending machines that we bought for cheap. And we stock it with stuff like Plan B and Narcan and pregnancy tests and pads and COVID tests. and it's free for anybody really who can access them. So you don't have to pay for any of it. Any supply helps. We do Narcan training multiple times a semester. So if you have some to spare, we're more than happy to take it and distribute it in our community.
Wonderful. That's so wonderful. These health kiosks. I really want to see a picture. If you can share a picture with us of what they look like, I'm sure it'll inspire not just, folks in academia, but all around, is to have, these resources available for free to folks who need them. Thank you so much. Anybody else have any ideas? Thanks to all of you who've been sharing, not just in this meeting, but also via email. Anybody else have any, visions for what the program can be? I can share that one of the ideas that we're floating around is doing a regional model for ambassador groups, right? So, a lot of us are in our neighborhoods and really are invested in what's going on in our neighborhoods. And, sometimes that information or that activity is much more relevant than perhaps what's going on in a different part of the state. And so our current model that we use, or one of the models that we use for regional engagement, is with our regional health officers, and which my colleague Omira Giatello, she's our regional health officer for our Bellwood and West Chicago offices. And so one of the ideas that we're thinking about is connecting, creating networks of regional ambassadors that could be plugged into not just your local health department, but the ones that are in your area, to also then be, volunteers or, participate in events that they have going on. I wonder if anybody has any thoughts around that model. Does anyone think it's a good idea, a bad idea?
What was the question again, Lubia?
Yeah. So the proposal is, or the idea still is, that we switch from a ambassador group that is all, like, we're all from all parts of the state, to a regional model. So where, for example, folks that are in the West Chicago area, or just Chicago in general, that we could be a more local network and have, regional meetings. And then that way, you all are more in tune with what's going on in your region, in your area, versus, and still be able to participate in other regions if that's of interest or relevance.
I do like the breakdown for each region. And so I was going to ask you what is the role of, you mentioned health officer.
Yeah.
Wasn't sure what exactly their role is in public health, but
Sure.
Definitely breaking things. Even I'm interested in breaking things down by neighborhood. Like when we're looking at data and things like that, because we try to bite little pieces off at a time.
Sure.
And so to really make an impact, I think we have to break it down as far as we can, even by neighborhood. So definitely region would be definitely a great idea as far as I'm concerned.
Yeah, I think so too. I can tell you that, the regional model has worked really well for us because we're a state agency, right? We deal with the entire state, but being able to, compartmentalize some of that work, right? I can tell you that. So I can, Omira, if you have a few minutes to chat about your role and, what you do regionally, and then that way folks can get a sense of not just your role, but like, what this regional connection might look like.
Hi, I had to get off mute. Sorry.
That's okay.
Hi, everybody. This is Omira. So I put down in the chat, I cover the following counties, and they're listed there. And if you notice, this is the area that's primarily primarily populated than the rest of the state. So it's to get you an idea. If she does this regional meeting per se versus inviting everybody, we can get down more to discuss what's actually happened in our areas versus someone that's in Alexander County down south and the border. They're like, what are you guys talking about? They might have different concerns than we may have. So I appreciate you suggesting that, Luby, and I think that's an excellent idea. And we can, let's think about this a little bit more and let's do it. As for my role, I've been doing this for the last 17 years. I'm mostly, covering the areas and any type of requests that come through. I'm able to navigate them to the correct person. The director, Dr. Vora, is not able to make it everywhere, so I could attend events. If anyone needs our wellness van for an event, health fair, etc., I can help with that process by providing the link, connecting you with the right people. We may have 1,200 or plus more of IDPH employees that I don't know everybody, but I get different requests. May not be related to public health, may be related to HFS or about your medical card. And I'm just a navigator in verifying that it's the right person they're going to get connected and that they're going to get the answer and not be left in the loop, jumped around, call this number, and nobody helps you out. So my main goal and my main objective in my role is to help everybody in whatever request it comes through, and get that settled. And then I do other stuff too, like I'm doing recruitment. So if you want a better idea, I'm just like a facilitator to the state, to our agency with many requests. I deal with the local health departments directly, too. So that's what my role consists of primarily. Thank you.
Wonderful. And so Omira is part of a team of 6 RHOs, right? These regional health officers. And what Omira does, other RHOs do in other parts of this, other regions. So we have someone that covers our Marion County or our Marion region, which is way down south. We have someone from Metro East, which is like Springfield and towards St. Louis. We have someone in Rockford, which is all the way up in the North County or northern counties. We have Champaign area, and then we also have Peoria. So we have somebody in every region. Our RHOs are there making connections with local health departments, with organizations, with community-based, faith-based, whatever, all in the service to provide that linkage from IDPH to community, and then also vice versa. Ricardo, I see your hand up again. Did you have something you wanted to share?
Yes.
Yeah.
You're talking about to make this regional and then to cook. I don't know if you're aware that the Chicago Cook Workforce Partnership in partner with UIC and Sushi and Chicago Department of Health has created the CHRC program, Community Health Response Corps. And they actually do everything that you're mentioning on a community level. It started with 32 community or CBOs, and now there's 11 CBOs that work in the city of Chicago in different communities, and they do housing referrals, they do eviction referrals, they do COVID-19 vaccines. They're ambassadors to the clinics for the vaccines in the city of Chicago and all the neighborhoods. They do bystander CPR, diabetes, health insurance, Medicaid, Medicare, HIV testing if it's necessary, and of course deal with the fact-based information for COVID-19 and promote the vaccines. A lot of the stuff that's community level, that's what they're doing, and that model is already in a working force here in Chicago that could be probably duplicated in different places, as you are mentioning now.
Absolutely. And I think Omira, you may have been the person that shared the core with me. But yeah, no, Ricardo, you're absolutely right. There's already these wonderful models of community engagement and partnerships. And I think, that's kind of also where the inspiration for a more regional model for our ambassadors program came from, right? Is that, folks are engaged at a local level and you have this wealth of information and connection, and people want to connect all the time. And so what better way to kind of transition to take our state model, right, of ambassadors, volunteers from across the state, that really are connected. They're public health champions and they want to learn more. So if you can do me a favor, Ricardo, can you send me an email with the information for that core? And then maybe we can collaborate, right? We can possibly, do some collaborative work there with our program, with their program, and see where, not duplicating efforts, but definitely enhancing what we could do for Chicago and for the state.
Yeah, I mean, this program has started with the contract tracing and now developed the Promotores de Salud and now with the CHRC. But of course, this program is finishing in June of 2024. And I think what we're talking about, how can we keep this alive at a community level that you're speaking about? And maybe that's what we should work on and get funding for this program and expand it more to the more communities of need. I think that that's something that we should do. I'm from the Puerto Rican Culture Center, and I've been the director of this program for the conference since 2020, and it's gotten better and better each time. And it's too bad that we might lose funding now, but I think if this is the direction that you're going to, we should look into collaboration and expanding this funding in order for the CBOs to continue their work in these communities of need.
For sure. Yeah, I love that spirit. Let's talk. Let's talk about it.
I'll put my email there. I'll put my email in there. Okay.
Wonderful. Thank you so much. All right. Let's see. I see some connections happening in the chat. That's wonderful. We're almost close to time, so I wanted to just ask one more time if anybody has any questions, any ideas, any comments about not just the proposal or the idea to shift our ambassadors program to a more regional model, but anything that we talked about so far in our meeting tonight.
Hi, this is April McMurray White. Hi. I just want to say I do agree with that. However, I just wanted to make sure there still will be an opportunity because I'm with what everyone else is saying on a regional, per region. However, we still want to know what's going on statewide. So will there be something maybe like a quarterly meeting for that perhaps, or once or twice a year? I want to suggest that we still do that because some of us, just like Ricardo just shared, although they may have different issues, but for an example, there may be a small brown community down there, Puerto Rican community that need those same services that are not there, that they don't know about. So I think it still would be a good idea to still bring us all together. So will there be an opportunity for that? Maybe once or twice a year? Perhaps?
Yes, absolutely. I'd certainly agree. Kind of to your point. So I live in Chicago. And so in my role, I've had to think more globally, right? Like about what's going on in different parts of Illinois. So I know that if I'm interested in it, I know you all are too. So, while we may, shift over to a regional, our focus is still as an agency, the entire state, right? And so if there is something that's happening on a statewide level that we feel like you might be interested in or need to know, or also that you're asking us about, right? Like if we think like, oh, they want to hear about this, but like really you want to hear about all of this. So that's definitely something that we can keep in mind for sure. So thank you for that feedback. I took down a few notes for that so that I can keep that in mind. Thank you.
Okay, and one more request.
Yeah.
If Tamika Booker, she's in my county where I actually reside, but not where my business is done, but in Kendall. I didn't know the NAACP was here, so I would like more information on that to connect with you, Tamika, if you would just share your contact information with me in the chat, if it's okay. Thank you, everyone.
Look at that. Wonderful connections being made.
Yes, definitely. I'll put my information in the chat, April. Thank you.
That's wonderful. I see a student put in a public health journalism approach in my student newspaper articles. That's wonderful. This is the exact kind of community that we're trying to foster, right? Where we're sharing out resources, we're making connections from every part of the state, not just within your region, but certainly across the state. And so yeah, I think I'm just gonna copy paste the whole chat so that I don't miss anything, and that I can share out the information that was shared in our post-meeting email. Well, with that, I want to thank you all again for making time tonight to to meet with us, to share some time, share some of your time after work with us. I think the other thing I was going to mention, last thing, is that I may consider moving our meeting time to sometime in the afternoon, so it's not so late. Maybe you can make it a part of your work. So if anybody has any feedback on that, I'd appreciate it. We can keep this time, if it works for you, if it works for the majority of folks, but also thinking, like it might be too late for some folks, and, just trying to be considerate. So if anything, if anybody has any feedback on that, you're welcome to put it in the chat. But as I was saying, thank you so much for making time tonight. As you know, we're still on a bi-monthly meeting schedule. So our next meeting will be in December, right before the end of the year. And I'll certainly have more details around this idea of a regional model, shifting times for meetings, meeting cadence, and then possibly, hopefully, bringing back our newsletter, reformatting and rethinking about what kind of information we're sharing out. But certainly, thank you so much for making time tonight. And we hope to engage with you again in December. If you have any questions, comments, if you're not getting my emails or anything, please reach out. I am going to put my email again in the chat, also my phone number. And that way, if something's going on, you're like, I didn't get the email link and it's, whatever's going on, feel free to send me a text message to my state phone, and I'll do my best to make sure that that you get connected, that you get the resources, and that you stay connected. So thanks again. Have a great evening. I'm about to put my phone number in the chat. Oh, Deborah, you're asking how to receive the recording for this meeting. I'm going to send it via email. All of the information, the recording, the slide decks, the PowerPoint presentations, all of that's going to go in an email. Okay. And again, if you don't receive the email, if you're like, what's going on and I don't get any emails, shoot me a text and I'm happy to work things out with you to make sure you get everything. Oh, we got an announcement. UIC is looking for health interviewers. Please contact Ada Giacello at AIDA at uic.edu. Thank you for sharing that resource. Awesome. Have a great rest of your evening, everyone. Take care.